Today's Wheelie Good Tip is brought to you by Access Community Health. Thanks guys for your support.
What happens is, the body goes into what we call as a catabolic phase, and there's certain disconnection between the brain and the spinal cord, which are really important for the menstrual cycle to return. And this takes some time. So usually patients you may lose your menstrual cycle for the first 4 to 6 months, but it does return. And there's usually no issues with fertility as far as female sexual function is concerned. And this is because the ovulation hopefully will return. Now, in case if it doesn't return, and I think it would be a good idea to get your GP to get some blood tests to look at the hormonal assays. And sometimes it needs referral to endocrinologist just to see what else is needed, or to gynecologist to work out what further investigations might be needed in order to look into this as such. When we talk about menstruation, obviously fertility side of things are really important, and I can see that is certainly a question in your mind. So what happens is ovulation most likely would return in 4 to 6 months time, and then you are quite easily you can get pregnant. If you're not planning a pregnancy, it's very important for you to use contraception, and this contraception can be in various shapes and forms. So when I talk about contraception, oral contraception is one. They are not very friendly towards spinal cord injured patients, simply because there's various combinations of these medications: estrogen, progesterone only. So it would be a good idea to discuss it with your GP or discuss it with a gynecologist to find out what is the best solution for you. Lots of patients do use Mirena. That is a device which goes into the uterus to prevent conception as such. Again, when you are having these kind of procedures, you ought to be aware of, or the person who is introducing this Mirena needs to be aware of autonomic dysreflexia, which I understand you're very familiar with. And these are the kind of things you would want to make sure are addressed before you look at what is the best contraceptive for you. And the simplest one is ask the partner to use a condom, and that goes along with it. And again, it's togetherness, it's about companionship, you see. So all these things slowly you explore and work your way through.